Hi, Yoly. Thank you so much for meeting with me today. Can you tell me a little bit more about yourself, about your previous job experience?
Yes, hello. Well, I come from New York. I started in New York, has having my experience as a medical receptionist. And my first experience was working for a chiropractor. We used to do pain management. So they had reports that were made, and I was the person in charge of making the reports. I also had to handle all the patient's information. I had to handle the schedule and everything that had to do with the office and the administrative side. I also had to, every once in a while, confirm patients' insurance information so that we could go and make or provide the service to the chiropractor's office. I also work as a cashier. So I do have that experience. I worked in Sears. I worked in BJ's. I work in Jetro. So I have like maybe 5, 6 years experience as a cashier. And after I started working as a medical assistant, that's the experience that I have. So I came to Florida 7 years ago, and I continued working. I work in a chiropractor's office most of the time, and I also moved to work with ITM Blood, which is a blood donation center, which I had to do the reports for each and every single donor when it was a positive result, because we had to provide the results of the blood for HIV, STDs, and hepatitis. So I would have to send the report to the Department of Health, and also we had to send it to the patient. Sometimes we had to make the patient come to the office, and we would have to give them the results. I also continued working with a dermatologist, and there I also had to handle the patient schedule, and sometimes there were surgeries that we had to handle. So I had to set up all the schedule and insurance information. And the last job I had was a rehab center, which we also had to schedule patients' appointments. We also had to call the insurance companies. We had to set up the appointments for the patients, and also schedule the timing with the people working at the center, the doctor, and the therapist. And well, that's most of my life. I have like 15 years experience. More than that has a medical receptionist. Mhm.
Okay, well, Yoly, thank you so much for sharing your previous experience. And let me ask you, so what are you looking for in your next position, in your next role?
Well, most of all, I'm looking for a place that I can stay. I also like to have a place that is busy. I've been in places in which we have had to handle 50 to 100 patients per day. So I'm pretty used to the busy way of moving in an office, and I can handle that. I'm also looking for a place in which everybody is willing to work and willing to be professional in their jobs, and most of all, teamwork. I'm looking for that. Hmm.
Okay, thank you for sharing that. And let me ask you, so what do you love most about your job?
Being able to help people, because that's most of all what you do in the medical field. Sometimes you have patients that have difficulties, and if they need that extra hand, I am willing to help them. Even if they can, sometimes they don't know how to use the computer, they don't know how to use the phone, and sometimes you have to go a little bit over the limit, helping them out with the transportation and all of that. I don't mind helping them with those situations.
Okay, thank you for sharing. And if the company decides that they would like to move forward with you, how soon would you be available to start?
Well, as soon as this week, if possible.
Okay, perfect, Yoli. Well, I just want to say thank you so much, for your time. It was a pleasure.
Thank you.